Happy March! Not only is March a great time for Michigan State basketball fans such as myself, go green, March just happens to be National Kidney Month, National Nutrition Month, and National Women's History Month. As a woman-owned business all about kidney nutrition, it's pretty much a month all about Melanie. And to celebrate, I'm offering a ton of different discounts and freebies all month long. Make sure you're on my newsletters list so you don't miss anything. You can head to kidneystonefreebie.com to make sure you're on there. Also, I have a special offer just for you as a listener of the Eat Away Kidney Stones podcast. I'm giving away free VIP enrollment to my signature course, Kidney Stone Nutrition School. To enter for a chance to win, all you have to do is leave a review for this podcast wherever you listen to your podcasts, take a screenshot of the review, and email it to us at hello@thekidneydietitian.org by March 31st, 2025. Good luck and happy Kidney, Nutrition, and Women's Month. Welcome to the Eat Away Kidney Stones podcast. I'm your host, registered dietitian and kidney stone expert, Melanie Betts. After learning a ton about kidney stones and helping people prevent stones at the University of Chicago, I was fed up with all the terrible advice people were finding online. So I decided to do something about it. The Kidney Dietitian was born. This podcast is for people who want to learn what actually works to prevent kidney stones and still enjoy life, eating, and their favorite foods. Let's dive in. Hello and welcome to the 87th episode of the Eat Away Kidney Stones podcast. As always, I'm your host, registered dietitian and kidney stone expert, Melanie Betts. And today I am tackling a topic and question that I get quite often, which is, do I need medicine to help prevent kidney stones? When do I know if I need to take medicine to prevent kidney stones? Does medicine really work to prevent kidney stones? And as always, the answer is very, very different for everyone. But I wanted to kind of give you an overview of my approach to medicine and kidney stones, because I think that it might be helpful for people before we just kind of jump to medicine. Because, spoiler alert, some people definitely do need to take medicine to prevent kidney stones, and medicine can be a very, very helpful tool in our toolbox to prevent kidney stones. But I think the problem is that unfortunately, medicine is often the only tool that's used to prevent stones, which I guess is better than nothing. I mean, if I have to be super negative, sometimes prevention of stones doesn't happen at all. So, maybe medicine is better than nothing. However, I think that the problem is that medicine is used blindly sometimes without 24-hour urine tests, and it should be used in addition to nutrition strategies. And unfortunately, like in many areas of medicine in our healthcare system, we just jump to medicine before trying other things if patients want to. So I think, let me kind of back up and explain my perfect situation of how medicine and nutrition can kind of work together. I think in a perfect world, someone has kidney stones and they get a 24-hour, in a perfect world, no one has kidney stones, but if we're working on preventing stones, right, a perfect world, someone has kidney stones and then they get a 24-hour urine test, because that is crucial, of course, to know why we're forming stones. If we don't have that 24-hour urine test, no matter what steps we take to prevent stones, whether it be medicine or food and nutrition changes, we're just guessing. And so I think we absolutely, of course, need that 24-hour urine test to know if medicine is even going to help. And then someone works with a doctor and dietitian and looks at that urine test to improve whatever urine risk factors they have with food first. I think many times people can make sometimes even small, sometimes they're not so small, but sometimes relatively small diet changes, and we can easily get those 24-hour urine test parameters into normal ranges, and we can prevent kidney stones with just diet alone. However, that is definitely not the case for everyone, right? Some people maybe are interested in making nutrition changes for kidney stones, and that is 1000% okay. Like, making diet change and lifestyle change is hard, and it is 100% each individual's prerogative to want to do that or not. And so if you don't want to make diet changes to prevent stones, then certainly we can jump right to medication. I think that's completely fine. However, I think the fact that you are listening to this podcast right now probably shows that you probably don't fit into that bucket, and that you probably would be interested in making at least some dietary changes to see if you could prevent stones. And so what I wish would happen is that people get that urine test and they work with a dietitian to actively help them make changes to prevent stones based on those urine risk factors. And if things don't get better, then sure, there's definitely a time and place to take medication to prevent stones. And I'll talk about in a bit later about the two most common types of medications that are given for people to help prevent stones. But I think what unfortunately happens most of the time is people don't get a urine test at all, and then maybe they're given medication sort of blindly to prevent stones, whether it be potassium citrate or a different thiazide diuretic. And so we have no idea if that medication is even targeting what is going on with that person. We also have no barometer to see if it's doing what we want it to do, right? Like we need to get a repeat 24-hour urine test to make sure that things are improving, whether it be that calcium is coming down or that citrate is coming up or whatever the issue is with you. And I think the other big piece of the puzzle is that even if we do give dietary advice, the vast majority of time, registered dietitians are not included in that counseling. And so doctors will say, oh, okay, well, you've got to cut back on protein and eat less salt. Okay, well, what exactly does that mean for you? How do you actually do it? And we know very, very well from research that unless nutrition education like that, like advice to say limit salt, doesn't come with counseling, which exclusively, quite frankly, comes from a registered dietitian, because doctors just do not have the time to do that, and most really aren't trained very thoroughly to provide that counseling piece, which is so crucial to actually change what you're doing to obviously then actually change the health outcome that we're talking about. So in this case, preventing kidney stones, right? People aren't just given a fair chance and shot at actually making that change if they're even given nutrition advice in the first place, which generally is not the case. But we don't give patients the resources and counseling, again, that they need to actually make that change effectively. So I went on a bit of a tangent there, but it's something that I'm just so passionate about, right? I'm just here to help people with kidney stones, prevent kidney stones, and live better lives. And it just breaks my heart, honestly, how little nutrition advice people get for kidney stones, and the little advice that they do get is typically either completely wrong, and we just talked about the oxalate thing, right? Or it doesn't come along with this crucial component of nutrition counseling, again, to actually help you make those changes, actually look at your life and your nutrition concerns and the food that you eat and help you make those changes. And that is the real beauty of working with a dietitian, I think, right? Like, yes, doctors can give you nutrition advice. Typically, they don't look at the big picture and look at everything going on, right? They're just looking at kidney stones or just looking at diabetes or whatever it has. But generally, doctors can give relatively good nutrition advice. But doctors are definitely not in a situation, certainly not in our healthcare system here in the United States, where we kind of have to pump out patients left and right to be able to maintain, financial feasibility. But that's a whole other conversation. But right, doctors just do not have the time to work with you and help you make those changes and set goals and really listen to everything that's going on with you, right? Like maybe the doctor is saying, well, you just have to eat more vegetables. But you're like, well, I don't like any vegetables. And so they're not really going to take the time to sit down with you and say, okay, well, what vegetables don't you like? What have you tried before? What would you maybe be willing to try? Or maybe there's fruits that might work, right? Like there's so many different ways to go about making a dietary change. And that is what a dietitian that specializes in kidney stone prevention can do for you, right? You can look at their 24-hour urine test and we can say, okay, XYZ is going to be most effective at preventing stones for you, and I'm going to work with you to actually make that change so this sticks, this is doable for you in your life with your diet and your family and where you live and your resources and all those things, and give you the best fighting chance to actually make that change stick. So, yes, that's what a dietitian, that's one of the reasons why dietitians, I think, are so great. But back to the topic at hand, which is medicine and kidney stones. So in a perfect world, right, we go through this process. We have that 24-hour urine test. You work with a dietitian to make changes. And most of the time, in my experience, working with students in kidney stone nutrition school and our dietitians experience via our private kidney stone dietitian packages, honestly, most of the time, we can get those 24-hour urine test numbers into normal range range. I'm using air quotes here because that's kind of subjective. I have another podcast about normal 24-hour urine tests, which you can definitely check out. But we can get them at least improved, and in many cases prevent stones from just diet changes alone. However, there are definitely times when that is not the case, right? There are times when people are doing everything, again, air quotes here, quote perfectly, whatever that means. I hate the word perfect, but right, they're kind of doing everything that they can to get their numbers into range, and it's just not working. And I think it's really important to remember, especially if you really dive into all the things that you can do to control those numbers on the 24-hour urine test. There are a gazillion different things that impact those numbers on the 24-hour urine test. Yes, nutrition is hugely important. I'm a kidney stone dietitian. I may be biased, but obviously that's definitely the case. But also, different medical conditions can impact those numbers. Genetics can impact those numbers. Different medications that you're taking for other reasons can be impacting those numbers. And so there are sort of other things out of your control that are impacting those numbers. And not to say that nutrition isn't important even in those situations, because if you're predisposed to high urine calcium and you didn't know that and you were just eating all the sodium in the world, your urine calcium is going to be even higher, right? So we're at least doing something, but maybe diet isn't enough to help get that, say, urine calcium down into a range where we would want it to be for optimal kidney stone prevention and also bone protection in that instance. And in those cases, I think that is where medication is definitely important and plays a huge role in kidney stone prevention for many, many people. And also, I think nutrition and medication they must go hand in hand, because similar to that genetic, right, example, if you're predisposed to have high urine calcium and you're eating all the sodium in the world, your urine calcium is going to be even higher than it would otherwise. Same is true if you are taking a thiazide diuretic, which is a medication that is very commonly prescribed to lower urine calcium in patients with kidney stones. If you're taking that thiazide diuretic and you aren't watching your salt, sure, like your urine calcium is going to be lower, but like it's not going to be as low as if you were not eating a ton of salt, right? Like basically what you eat can help that medication work more effectively. So in short, medication and nutrition can absolutely go hand in hand. I think that it is silly to suggest that it's one way or the other. I actually really hate the phrase food is medicine, which maybe sounds weird coming from the mouth of a dietitian. But I think it kind of implies that medication isn't good, which is definitely not the case, right? Like food is absolutely important, and food can play a huge role in health and the prevention of kidney stones specifically, but it's not medicine. And sometimes we need medicine to prevent stones. And so, in short, I think we need to go to nutrition first if the patient is interested in that. Again, sometimes people aren't interested, and that's totally cool. But what I wish would happen is that people went to food first and people were given the opportunity to change their lifestyle and their eating habits to see if we can get those 24-hour urine test numbers into a safe enough range that they feel comfortable with and that can prevent stones that way before jumping to medication. I suppose the other scenario is that if someone wants to do everything possible to prevent stones and they're not willing to wait around and try diet first. I suppose that might be another scenario that I could definitely see happening where, people are so afraid of having another stone. They're like, you know what? I'm going to do all the things diet-wise, but I also want that medication to get that urine calcium down or citrate up or whatever it is. And that's totally fine too. I think, right, that's what's so important about finding a good healthcare practitioner, whether it be a doctor or dietitian, because medicine is not black and white. It's not one size fits all. You need to have a healthcare practitioner that works with you, that listens to you, that, understands your priorities and, all these things so that they can come up with a plan that works for you with your priorities and goals and that you feel comfortable with, honestly. So from a high view, that's kind of my approach, or what I wish was the approach to how food and medicine can work together to help prevent kidney stones. So with that, we're actually going to take a quick break and listen to a message from a sponsor. Hey there, Melanie here. If you know me at all, you know how important research is to me. Research shapes everything I bring you as the kidney dietitian and is crucial to improve the lives and healthcare of people with kidney disease or kidney stones. I actually have a super exciting opportunity for you. The NIH is doing a study to understand what makes life better for African Americans living with kidney disease. If you are African American, have kidney disease, live in the Washington, D.C., Maryland, or Virginia area, and are at least 18 years old, we need your help. All you need to do is complete the short survey linked in the show notes to see if you are eligible to participate. If you are chosen, you'll be asked to complete 3 surveys over the next 3 months and receive up to $50 in gift cards. Please take advantage of this chance to help other kidney patients. Click the survey link in the show notes. So next I wanted to give a high-level overview of the 2 most common medications prescribed for kidney stone prevention to help you understand a little bit about what they do. Since I get so nitty-gritty in this podcast and certainly in my other content about, what exactly food does to prevent stones from that urine chemistry standpoint, I thought it might be interesting to understand what medication can help us do when we're looking at improving your urine risk factors for kidney stone prevention. So I think by far the most common medication prescribed for kidney stone prevention is something called potassium citrate. This is actually sort of a normal nutrition supplement. You can actually get it over the counter. And it is prescribed for 2 main reasons. One, potassium citrate is a huge dose of alkali, or the opposite of acid. And so potassium citrate will increase your urine pH level, which is a really good thing, especially if we're trying to prevent uric acid stones or calcium oxalate stones and your urine pH is low. On the flip side of that, calcium phosphate stones become more likely if your urine pH is too high. And so there's definitely a balancing act. And this is one of the many reasons why I think it is dangerous to be blindly prescribing, whether it's potassium citrate or diuretics for stone prevention, because before we have that urine test, before we know what's really going on. But in many cases, our urine pH is already too low. And so we prescribe potassium citrate, which is a huge dose of this alkali, to help get that urine pH up, because that's going to make it much harder, if not impossible, for uric acid stones to form, and also slightly less likely for calcium oxalate stones to form. The other reason that we prescribe potassium citrate is to increase urine citrate levels. We know that having low levels of citrate in your urine, it make it much more likely that calcium-based stones are going to form. And so basically because citrate makes it hard for, or citrate binds to calcium and dissolves it away essentially. So the less calcium in your urine, the less calcium-based stones you're going to form. And so sometimes potassium citrate will be prescribed simply because you have low levels of citrate in your urine. Another medication that is way less commonly but sometimes is prescribed is sodium bicarbonate, and this works very similarly to potassium citrate. Sodium bicarbonate is a huge alkali load, and so it is going to increase that urine pH and will also actually increase citrate levels, because citrate is also an alkali source. I won't get into that too much, but that will work very similarly. However, it also comes with sodium, which may or may not be a great thing depending on your situation, and typically a pretty large sodium load. And so generally potassium citrate is prescribed for patients with kidney stones to, again, get that urine citrate or urine pH up. But sometimes, depending on your kidney function or other medications potentially, patients can't handle that really large dose of potassium. And so typically I see that's when sodium bicarbonate is prescribed. But there's other reasons as well, maybe doctor preference or other things. So that's definitely the first class, is that potassium citrate / sodium bicarbonate, which is prescribed to, again, increase urine pH and increase urine citrate. The next most common type of medication that is prescribed for kidney stones are a class of diuretics. Specifically, this class is called thiazide diuretics. That's just a fancy word. There's a couple different classes of diuretics, and they work in slightly different ways. But thiazide diuretics are very effective at lowering how much calcium is in your urine. And if you've been around me for a long time, you know that high levels of calcium in your urine are very common when it comes to both calcium phosphate and calcium oxalate kidney stones. And so this is a very useful medication when we're not able to get urine calcium down with diet alone, in a perfect world, as I talked about earlier. There's a few different thiazide diuretics available, but in my experience, the ones that I see most commonly prescribed to patients for kidney stone prevention is a medication called hydrochlorothiazide, chlorthalidone, and indapamide. I think those are definitely the most common ones. And again, these are just a specific type of diuretic that works in a way that allows us to help us get your urine calcium down. And really, that's it. Those are by far the two biggest medications that are prescribed for stone prevention. There's certainly different ones that come into play based on specific situations, but this, probably 95, if I had to guess, of medications prescribed fall into these two categories. So I hope that was helpful. Again, I get a lot of questions about medications and do I need to take them? And as always, it really depends on your 24-hour urine test and your situation and what you want to do and what your goals are, whether you want to try nutrition or not. If your doctor's willing to let you try nutrition first, and all these types of things. As always, I hope that you enjoyed this episode of the Eat Away Kidney Stones podcast. I am definitely looking for more listener questions to be answered on the podcast. So if you would like to submit a question for a chance to get answered by me on a future episode of the podcast, definitely head to kidneystonepodcast.com. That is also linked in the show notes as always. And that is just a really, really, fun way to connect with you. I love hearing your voices, especially. And I just love doing those listener question episodes. So definitely record a question, send me a question if you have something that you would like me to answer on the podcast. You have a wonderful day, and I hope to see you next week on the Eat Away Kidney Stones podcast. Thank you for listening to today's episode. For more help with kidney stones, check out my website, www.thekidneydietitian.org. For more personalized help from me, check out my online course, Kidney Stone Nutrition School. VIP enrollment includes help directly from me. I can't wait to see you there and help you prevent kidney stones. Have a great day.